Welcome back. Today, now I would like to cover the last part of rules and regulations for dental practice in India. I'm Dr. Charubala Pavan and welcome to my channel. We start with labor laws. Every state has got a labor website wherein we have to check where we stand. Some states, like I said earlier, mandate the Shop and Establishment Act. That is also found in the same website. So labor laws are basically applicable to those facilities which have more than a certain number of prescribed employees, which is again state specific. But there are some important points which all of us need to know regarding labor laws. One is minimum wages. If we have certain number of full-time employees as prescribed by the state, we have to provide them with minimum wages as specified by that state. There is ESI, Maternity Benefits, Sexual Harassment Act, and Contract Labor Act. All these come under labor laws. For example, this is the website of Andhra Pradesh Labor Department. And this is an annexure which I have taken from Gujarat Labor Department website, where they have mentioned, for example, point number 15 is that if you are having employment in a hospital or nursing home, then this is the amount which has to be paid to skilled workers, semi-skilled workers, unskilled workers, depending on whether the hospital is situated in a rural or an urban area. So such similar amounts would be specified in each state, and you have to go according to the law of your state. Other laws by which we are bound, mostly these are for hospitals. That is, for example, supposing your hospital has got a pharmacy, then they come under Narcotics and Pharmacy Act. Spirit license, if you're storing a certain amount of spirit in your facility. License for explosive gases. Diesel license, if you have a diesel generator. Ambulance vehicle permit and insurance for hospitals. Lift license, if you have a multi-storied building. Income tax and professional laws, these are professional tax laws which we are all bound by. IT Act 2000 and other state specific laws, for example, Andhra Pradesh Allopathic Private Medical Care Establishment Rules 2007. So this is another example I have given. This is in Andhra Pradesh, they have YSR Arogya Shri, which is a government empanelment scheme. So they have certain basic requirements. So you have to look at such laws as well. For example, you have to have minimum 3 dental chairs. You have to have parking space. Your building plan has to be approved. You have to have an occupancy certificate from the municipal commissioner. All the other statutory requirements which I had spoken about in the earlier videos. Manpower and space requirement according to their prescription is 1000 square feet of space should be there with minimum of 360 square feet for dental chairs. Radiology should be there, recovery room should be there, dental lab, sterilization room, all that should be available. Financial details and bank details have to be entered with the government. So you have to have all these things if you want to take part in their government empanelment scheme. There are 2 other laws which I would like to talk about. One is National Digital Health Mission or Ayushman Bharat Digital Health Mission. The implications of these are, one is that we have to all learn to digitalize our records and follow the standards which are prescribed by the government. We have to be able to access digital reports, treatment history, etc., which are already present of patients. They might have taken treatment elsewhere and we have to be able to access their records. We have to register as Digi Doctors and we also get the facility of having a digital signature if we are a part of the scheme. So what the government has tried is they have tried to create an intersection of the health domain and technology by creating this particular facility. They have provided digital health iCards for patients. It's an absolute voluntary process. And how you create it is that you have to enter some basic details and link it with your Aadhaar or driving license or mobile phone on a website which the government has created. It's also available in an app form, or if it is not possible to do it on your own, patients can also go to participating health facilities, that is hospitals which are nearby, which are already registered, and they will help you with the registration process. Who is eligible? All Indian citizens are eligible. How does it work? The card enables the patient to interact with verified healthcare service providers and receive prescriptions, lab reports, diagnosis, and all the medical records are saved in an encrypted, safe, taking full care of the privacy of the patient. It is stored in a digital format. If at any point of time the patient feels that they want to withdraw from the service, they have that facility also available. Another important law which has come is Medical Devices Amendment Rule 2020. All medical devices are now classified as drugs. So they are registered under Drugs Controller General of India. So what does this mean for us? Dental implants, maxillofacial implants, orthodontic implants, all these come under newly notified medical devices, and the manufacturer has to provide stickers for all these, and you have to keep these in records for all types of surgical devices. Like we keep implant stickers in our record books, similarly these stickers also have to be preserved along with our medical records. These were some important laws which I wanted to cover. Apart from this, I would like to say that there are certain trainings which should be conducted in all practices. One is BLS, that is Basic Life Support Training, CPR. Then we have medical emergencies in dental practice, infection control training, biomedical waste management training, and fire safety training. These 5 training programs should be conducted for all staff. So to recapitulate, in all the 5 videos, these were the laws which I spoke about. One is registration with Dental Council, ownership documents, registration with District Health Authority or CMO or municipality or CEA, registration with Stop and Establishment Act, Electricity Board, fire laws, Pollution Control Board authorization, biomedical waste management laws, AERB laws, Clinical Establishment Act, income tax and professional tax, license for ambulance, labor laws, Narcotics or Pharmacy Act, spirit license, diesel license, IT Act 2000, and other state-specific laws, lift license. 2 new laws which I spoke about was National Digital Health Blueprint and Medical Devices Amendment Rule 2020. So these were the basic laws which I covered. There could be a couple of more laws because it is state-specific. Certain states or certain union territories might have certain points which I may have missed, but this is the final overlook of the entire laws which we have to follow as oral healthcare professionals practicing in India. These are my contact details, my WhatsApp number, my email ID. For more such videos, please don't forget to share, like, and subscribe to my channel. Thank you very much, and do come back for more such videos. Thank you.